Hey everybody, welcome back to my channel. Today we are going to reveal my scars. We're going to talk about the entrance for an ALIF incision and all the fun things that come along with it. So stay tuned, let's go. It'll be a quick video today.
Did you know that over 20% of Americans in this past year have suffered from chronic pain? That's a lot of us. So let's get through it together. I'm Chris Lopez, and this is Bionic Living.
Hey Bionic team, welcome back to my channel. We're going to be looking at my scars today, and then we're also going to talk about how the doctor got in through the front of my spine, through my belly, and all the fun stuff that I had to deal with in the hospital after that. And then also a fun little thing that can happen for you men out there after receiving your ALIF procedure. So if this is the first time you're joining me for a video, I have went through a ALIF, PLIF, spinal fusion at the L5-S1 level of my spine over 7 months ago. I hit the 7-month mark around the 24th of April. I think we're about a week after that. My back is feeling great. All the pain I had in my right leg and down my right leg is gone. I am now, though, having pain into my left hip. I have also really bad hip arthritis, have had multiple surgeries already on my right hip, and in a few weeks I'm going back to the hip surgeon to see what's going on with my left. I hope it's just something soft tissue that we can work through because I cannot endure any more surgery. So getting back to my back, this video is not medical advice. This is anecdotal information that I am providing from my own personal experience after this surgery. I'm putting this out there to hopefully help you feel better about your surgery, to help you get through the post-op recovery of your surgery, and just to keep on living that bionic life after recovery in total from surgery in whatever capacity you've had it. So the first thing I want to talk about today is where the scars are on my body and what they look like. To be honest, I don't think they look that bad, but we'll take a look and we'll discuss. What happened to my shirt? I took it off so you guys can see. So this is where the vascular surgeon, not the orthopedic surgeon, the vascular surgeon went into the anterior aspect or the front aspect of my spine. I had no sutures. They're all absorbable and deep sutures. And then I think I had skin glue that held it together. But so here's the incision that was made right below my belly button. Not too bad. I'm okay with it. It looks like a treasure trail. It's cool. Then I have 2 more incisions right here on my lower back where they went through and took out the lamina and fused from behind. Some people call this procedure a 360 procedure because they're going from the front and the back. But there you have it. Here's the front incision. Yours might be different. Here's the back incision. Okay. And not too bad. So there's a lot that can happen complication-wise and just difficulty-wise after having this anterior approach for your spinal fusion. I will tell you, the back incisions I had, I never thought about them. They never were an issue. And there's very little space between your skin and the actual bone where the surgeon's going to be working. So there's really not much to move out of the way. So those heal up pretty quick and they're pretty, out of the way, and you don't think about it that often. I at least hope that you don't. But this anterior approach comes with a lot of baggage. After the surgery, you can't eat for a few days because they do have to move around your intestines. You're on and under anesthesia for many hours. I think my case was about 6 to 7 hours long. So also when you're under that anesthesia, your entire gastrointestinal tract doesn't work either. It slows down. So it takes a while to wake back up. So for many days after the procedure, red Jell-O became my best friend. And I think I ate a little too early before my bowels were really moving, and I got what was called ileus, where you get impaction in your bowels and you're not able to pass gas or go to the bathroom, number 2. Another fun thing that happened to me is I had urinary retention, so I wasn't even able to pee. So I had it coming from both ends. It was super fun. I even had a nurse straight cath me because I was retaining too much urine. So they pretty much took a straw, popped it down through my penis, and released all the urine that had been building up. They only had to do that once, thank God. And then to be even more graphic, for my ileus and my constipation, from the anesthesia, the moving of my bowels to get through the front of my stomach, and the pain medications, I had all the milk and magnesia. I had medication to help me move my stools. I had suppositories. I had enemas. I think it took 2 enemas that I held in for like 45 minutes to an hour. Finally got me moving on day 5. So that was really a struggle the first 5 days in the hospital. Was just trying to pee, just trying to poop. All in the time I'm trying to learn how to walk after the procedure and learn how to put on my clothes and maintain a good pain level. It was really, really tough. And I don't want to ever go through it again. But it was worth it because my back pain is gone, my right leg pain is gone, and my drop foot is gone. But some other issues with the ALIF procedure, especially from the front, and this is for men, that you can get something called retrograde ejaculation. And this is why you might see in my thumbnail, I put sperm banking. When I was getting my back injections from a pain specialist, he's an interventional radiologist, I was talking to him about my plan to proceed with the spinal fusion. And he mentioned, have you heard about retrograde ejaculation after that procedure? And I had. Another doctor that I got another opinion from had mentioned that he doesn't go through the front because the likelihood of a man receiving that. So this is weighing over me through the whole process of trying to have this spinal fusion, is this retrograde ejaculation. So he finally explained it a little more in depth than the other doctor, that you still are able to orgasm, but you don't produce any type of semen, or you don't ejaculate any type of semen, possibly after this procedure. So that is definitely something to consider. I looked up in the research and it says about 1.4% of men will have this complication. For some it's temporary, but for most it's permanent. So the main takeaway from this video today is that if you're a male and you are looking to have a family of your own, this is something to think about. You could never come again. And that is why I recommend, if you're having an ALIF procedure and you're a male who hasn't had children yet, who wants to have more children, who wants to have your own children, to bank your sperm before the procedure. Now me, I'm a middle-aged gay man who's single. I'm probably not going to be having my own children. I always imagine myself adopting if I'm having any children at all at this point in my life. But I did not sperm bank. But the day of surgery, the vascular surgeon came in and his first 2 questions were, are you married? And have you had your kids yet? And I knew exactly what he was talking about because I've had the other physicians bring up this retrograde ejaculation subject matter. But if I had not prepared myself for it, and the day of surgery having the vascular surgeon bring it up, I would have canceled the surgery because I've been like, what the? And thank God I had the medical literacy ahead of time to prepare myself for this conversation. But once we got past that point that no, I had not banked my sperm, and no, I don't plan on having my own children, and no, I'm not married, thanks, that we proceeded. But he was like, we can cancel the surgery today if you need to. And I was like, no, I'm prepared, let's move forward. So you may be wondering why I keep talking about a vascular surgeon, so I want to review. The vascular surgeon does an incision and entrance approach for the spinal orthopedist or neurologist, whoever you may use. You might have a general surgeon doing it, but I had a vascular surgeon perform that dissection so the orthopedic doctor could do the bone work, and then he closed everything back up. The next day after surgery, he did let me know that they stayed completely away from the nerve that would cause the retrograde ejaculations, that I should have no problems. And I'm fine. I do have to say there is a little change in, I would say, my sexual prowess. but hopefully that will get better as I just recover and get stronger with time. But I do not have it. I didn't have any experiences with it, so thank God I'm not one of the 1.4 men who will have retrograde ejaculation after an ALIF spinal fusion. The reason they have the vascular surgeon or the general surgeon do the dissection in the front of your belly to get to that spine is because there's a lot of stuff there that the orthopedic surgeon doesn't want to damage. You have two big blood vessels, okay, your aorta, I think, and then your inferior vena cava, two big vessels that you don't want to nick because that's the main blood supply down into your legs. So the vascular surgeon I had was from Northwestern Memorial Hospital, along with my spine surgeon, and I think they just did a great job. It was rough after the hospital stay. I think I had it pretty bad. I think I ate too early. I didn't stick on that red Jell-O diet as long as I should have. So hopefully yours won't be as gruesome as mine was. And again, to review, I didn't get retrograde ejaculation, but it is scary and you should know about it and educate yourself about it and prepare for it. Get that sperm into a banking system, just in case if you're really looking to start a family and you're suffering from lower back pain and leg radiculopathy. So if you like my videos, please subscribe, check out my other videos, and I'll continue making content. Hopefully it'll get better. Like right now, help me out with sound. Is there microphones that you can use or buy to help with the sound so you don't have like the echo of your space? Let me know in the comments below. And then just keep on bionic living that best life.